Okay, we're going to start now. So I think everybody knows what we are talking here, yeah? Because of the COVID-19 pandemic, so we are organizing this special session for everybody to learn something very simple. First thing, if you look into the reports on COVID patient, and a autopsy done on COVID patient, you realize that there are plenty of phlegm stuck in the alveoli, in the lungs, particularly the lower portion of the lungs. And because of that, the lung can no longer function well, right? We need the lung to make exchanges with the body to supply oxygen to the blood so that the oxygen can be supplied to the whole body. So when the lung is not working, then the body will not work. So this is the problem that brought fatality, that is fatal problem. Now, so one of the important things that we want to do is to make sure that the lungs get thorough flow. Thorough flow of what? Thorough flow of qi, so that subsequently the flow of air will be good, right? So number one, thorough flow. Number two is about abundance. You must have sufficient qi inside your body, right? That's what we call abundance. So that your immune system will be balanced. I use the word balance. Yeah? Now, so first, thorough flow. Second, abundance. So how are we going to do it? It is rather simple. All of you here know what is La Qi. I know that conventionally, when you do your La Qi, you are doing it in such a way like what we call, you don't synchronize with the breath. And some of you have read on the internet saying that when you do your La Qi, on opening up, you breathe out. Now, we have a different opinion, okay? Over here, we are trying to strengthen the natural function of the body, all right? Restoring natural function of the body, okay? And we do it in such a way that is natural to ourselves. Okay, watch. So when I am hanging my arms this way and I breathe in, see, my arms open up. So when we ask you to do La Qi over here, this is our in-house exercise, all right? We want you to do it in such a way that on breathing in, you follow the natural expansion to open up. On breathing out, you restore. Okay, pay attention to this. Huh? On breathing in, you follow the natural movement of arms going out, and you spread out your arms until they're almost in straight line. Yeah, or slightly stretched at the shoulders here. All right. If you open up well enough, you'll find that naturally your spine would arch a little bit to the back. It would arch a little bit naturally to the back. Okay? Natural movements, right? Breathe in. And on breathing out, they restore. Now, the second thing is that we will be focusing on the 4 areas. We use the word areas, right? Yintang here doesn't mean you only work on this point. It is the point behind this or inside the brain. Okay, so let's say when I say, and when we say that you do your open close here, you spread out your arms, you do your open close here. You feel as if, or you visualize as if your arms has gone inside and then coming out. Okay, likewise, when we go down to the chest, it is the same thing. Like when I'm breathing out, my arms, my hands go inside. But Do not touch your body. Do not touch your body, right? So I'm breathing in. I'm opening my chest, right, to the blue sky. I'm breathing out. I bring in the blue sky into my chest. And then lower down, Zhongwan. Zhongwan is a point that is very important for the digestive system. Or some people say that this is the center of middle dantian. All right? Okay. Remember, again, this is inside, not on the surface. I'm breathing in. I open up. On breathing out, I bring in the blue sky. Right? And then I go lower down to the navel. Navel, behind the navel, what is that area? Many people will tell you that, okay, that's the lower dantian, okay? So simple. Again, it is not the point on the surface, it is inside. I'm breathing in, I'm breathing out. Right? Simple enough. Now, the next thing is that when we are doing this exercise, there's something what we call, some of you, we're going to do it for half an hour. And we are very nice people. We understand some of you may complain after 5 minutes. You find that, oh, this is unbearable. These people are crazy. What are they doing, right? So being somebody nice, we want you to do something like this, right? If you find that this is too challenging, all right, even after 5 or 6, you find it too challenging, you can do it small. It will not be so demanding on your chest and your arms. You can do it small, okay? Remember that. Now, we do not want you to suffer in this session, okay? We do not want you to, no. Okay? This is absolutely important. You can do it small, but synchronize with your breath. If you find it challenging, the large one is challenging to your arms. Then the next one. Hey, where's my cursor? Now, this is what we call flying in the blue sky. I'm not sure how many of you look up to the blue sky, what you call it, frequently. I enjoy looking at the blue sky. Anyway, what we want you to do is when you are doing this, visualize as if you are a big bird flying in the sky, spreading out your wings, all right? Closing in your wings, spreading out, closing in, okay? If you have forgotten what is a blue sky, what blue sky looks like, look at the screen here, all right?